Normal BMI of 24, height 5 foot, weight is 126 pounds, no children, late 20s, 360 fat transfer, so the waist is going to be as small as can be. She's kind of squarish, so we're going to go from a square to an hourglass. We're going to be adding fat not only to her buttock, but also to her thighs. This procedure is not just about butts, it's about creating balance and beautiful shapes, and that very frequently will involve adding fat to the thighs as well. Patient's 5 feet, 126, BMI is normal at 24. We're doing 360 fat transfer, so 360 lipo is going to bring in the waist. Fat transfer is going to build up her hips. We're going to change this relationship. Right now is kind of like a V shape. She's wide and then narrows in. When we're done with the procedure, she's going to have a tiny snatched waist, and we're going to add some fat to the hips to create curves. 360 lipo fat transfer. We're going to lipo from here to here. This is where the hip roll and the waist is, so this is where you really create that curve and contouring. Recall she has a normal BMI, but even with a normal BMI, we can get maximum fill in the buttock. So a lot of questions are, what's the ideal weight? There's no ideal weight, but I think if you're normal BMI, it's just right. We can still get maximum fill in the buttock and the thigh. 360 lipo fat transfer, normal BMI. So this is not a high volume case. I usually take out around 5 or less liters on these procedures, about 1100 injected of fat into the buttock and thighs. You can see very nice curve from behind, really nice curve from the side. Overall, very proportionate and balanced shape for this patient. 360 lipo fat transfer. A lot of patients ask how thin can they go, about a centimeter or a finger breadth. That's how thin we usually thin someone out. We created a curve. I added as much fat as possible to the thighs. Everyone has a different amount of space in here. So some patients I can really expand more than others. I usually put in as much as I can. This is the most I can do for her. It's nice, it's subtle, and it's a great improvement. Normal BMI patient, I think normal BMI patients are probably the best candidates because I can clear out all the fat, there's none left over, and we get maximum fill in their buttock. Regardless of the BMI, low, high, normal, we always get it right, we always get the hourglass effect. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.